Cataracts are extremely common as we age. The National Eye Institute reports that more than half of all Americans age 80 or older either have cataracts or have had surgery to correct them. But the technology is only getting better. And today's Transformation Thursday, Dr. Priya Mathews from the Center for Sight is the Director of Ocular Surface Disease, and she's here to talk about a new light adjustable lens. Great to see you.
Thank you so much, Stephanie, for having me today, and I'm really excited to talk about something that I'm so passionate about.
Well, we hear about cataracts literally over and over right now.
Yes.
Just for those of us who don't really understand, what do you do to an eye in cataract surgery?
That's a great question, and even though we hear cataracts, we don't really actually know what's going on in the surgery. So first of all, everyone gets cataracts at some point in their life. Usually they start developing after the age of 50, but at some point everyone will need surgery. And when you have surgery, it's really dependent on, you have to medically qualify, but also when you start feeling like your activities of daily living are impaired. And that's the right time to have surgery. During surgery, we remove your cataract, and then we put in a new lens. And that lens is customized for you so that you can see at a particular distance. Some people, their goal may be to be able to see the golf ball, especially in Sarasota. Other people, maybe it's going to be reading or stitching. And so depending on what your goals is, we're going to put a new lens in that allows you to see after cataract surgery.
Okay, and from what I understand, there are some choices in lenses. So
Yes.
You wanted to talk about the new light adjustable lens. What makes this special?
Yes, what's different about this lens, which has actually been, I think, a game changer in our field, is that we can actually change and improve your vision after surgery without doing an additional surgery. So the surgery itself is just a few minutes, same as all types of cataract surgery. Take out the cataract, put in a new lens. But what's different about this technology is after you've healed, maybe about 3 or 4 weeks, then we can actually do small adjustments to the lens using UV light. So it's quick and painless, about 1 to 2 minutes, and that actually tweaks your vision to give you better either distance vision or reading vision or both. So it's pretty interesting. Patients will come in, they'll tell us, I can see great distance, but I want to be able to read the computer also without my glasses. So we'll do a small adjustment, they'll try it out for a week, and then come back the following week and say, this is perfect, or I want some more reading.
I love this.
And so we have about 3 to 4 adjustments that we can make.
Okay.
Every week we make one. And then finally, when the patient's happy, we lock it in and they're set.
Okay, now are there certain patients that are candidates for this more so than others?
That's a great question. So almost everyone is a good candidate as long as their pupils can dilate, because it's important for us to be able to visualize the entire lens when we're doing the treatments. But there are certain patients that are really great candidates, I would say. And I put them in 2 categories. Number 1, patients who have had previous eye surgery, especially LASIK. Okay. Our calculations are a little less predictable when we do LASIK, so having this ability to tweak afterwards is an advantage, because after surgery we can kind of refine and get that perfect distance or that perfect reading. Another group of patients that really love this lens, and I think this is actually more common, are the people who want to have a say in what their outcome is. They're not exactly sure, like, I think I really want distance, maybe I want some intermediate vision. Intermediate is huge: computer, cell phone, dashboard. Right. That's a very important focal point. And so this is really good for people. This is a really good option for patients who really want to test drive their vision. Try it out, refine it. An analogy I use for my patients, which really resonates, is that instead of buying a dress just off the rack, you're actually buying a dress, but then every week you're kind of tailoring it and customizing it until it fits perfect for you and your needs. And every person is so different. I mean, some people are all about golf, and some people are about their computer, and pilots want a little bit of both. And so depending on what your lifestyle is, we can actually get it perfect for you.
It sounds amazing that you can certainly tailor make something like a lens in an eye to be so perfect for someone's lifestyle. What other types of advances? I noticed that you said LASIK.
Yes.
Where are we with LASIK these days? Is it allowed a little bit more tailoring as well?
It is. That's a great question. So I perform LASIK as well, in addition to cataract surgery, and it's more customized. Before, we used to just put in the prescription in your glasses and then treat that, which works really well, actually.
Right.
But now we have the ability to also customize it to the shape of your cornea. So we incorporate more of your prescription as well as your own actual cornea. We take thousands of data points and custom create a treatment for you. And that really helps not only with your vision, but night vision. And it's really, the quality of LASIK has improved. There's also a really good new surgery called implantable Collamer lens, which is instead of doing LASIK, we can actually put a lens in your eye.
Okay.
For young patients with a very high prescription.
Right.
And the quality of vision is outstanding. So that's an exciting new technology that we're offering as well.
There is some awesome technology here on the SunCoast. I really appreciate you coming in to tell us about it. A few things more important than our eyes, and they're in very good care. For more information about any of this new technology, cataracts, LASIK, and otherwise, you can go to centerforsight.net. We'll be right back.